Hi, everyone. Welcome. Give people a minute as they join us today, depending where you're joining from. We know in Ontario, at least, it's March break. So a busy time, or maybe a restful time, depending. But we're very excited to have you here today as part of our March webinar, which is titled Sustaining Change in Neurodevelopmental Disability Initiatives. We have three fantastic presenters today who I'm sure you've either met or heard of before, and I will let them introduce themselves once we get to that portion of the presentation. Give it a minute. All right, let's get started because we have a lot of awesome content to go through today. So prior to getting started, I want to take a moment to acknowledge the land and give gratitude to the lands in which we all have the privilege to connect, build relationships, grow, learn, and do this great work together. So my name is Vanessa, and I have the privilege of being the Kids Brain Health Network Implementation Community Facilitator. My primary role is also through McMaster University and CanChild as a postdoctoral researcher. So on the slide here today is a photo of the city now called Hamilton in the province of Ontario, where McMaster University is located on the traditional territories of the Mississauga and Haudenosaunee Nations, protected under the Dish with One Spoon Wampum Agreement, which represents an agreement for sharing and a joint responsibility for care. We can think about that in terms of our land, in terms of society. Right now, in particular, as the weather is changing, thankfully, we are having more opportunity to connect and be out in nature. And so I would encourage you to share in the chat if you're comfortable, your locationality and any reflections you're comfortable sharing, as we also want to acknowledge that Kids Brain Health Network and ChildBright are national in scope and reach. We acknowledge the many lands and traditional territories that our networks operate on and that you all on the call today are joining from. So the KBHN implementation community, for those of you who've tuned into past webinars, we've gone over this previously. So I'll give a high-level overview. There is a QR code here on the slide if you're interested in learning more and checking out past webinars and more information. Really, in its entirety, the goal of this community is to connect, build relationships, and advance implementation science in the neurodevelopmental disability field. So this is achieved through building capacity amongst Kids Brain Health Network, funded past and present projects, connecting networks and with networks such as ChildBright to learn and reflect on different topics together and really build that community in implementation science. Pass it to Corey.
Oh, this is mine. Well, thank you, everybody, and thank you, Vanessa. KBHN is so thrilled to do this work, but of course, we are now KBH Plus. The network is really funded by those public dollars to help scale and spread implementation. But we also have our foundation leveraging philanthropic dollars and our innovation fund unlocking private capital to invest in all of the incredible solutions so that we have some great outcomes for kids and families. I'll also say, though, and I'm excited to share that we have our conference coming up with the title From Evidence to Everywhere, Scaling and Sustaining Innovation for Kids. What a timely webinar for a conference like that. Really excited. So encourage folks to consider registering. The registration page should be up tomorrow, I'm told, just as a little teaser, but also sharing that our abstracts have been extended until April the 13th as our deadline for submission. So if anybody is still thinking about submitting, you've got a few more weeks. I know Rachel at least is excited about that, so that's fantastic. And with that, I'll pass it over to the next, but just really thrilled to be able to welcome all of you folks here today.
Hi everyone, I'm Celia. I'm here today representing the Child Bright Network, which is a patient-oriented research network that really also tries to focus on supporting youth and families with neurodevelopmental disabilities. So we're quite a wide network with well over 500 members that are based across the country, really trying to promote that patient-oriented research focus, working across all different areas and having partners part of every aspect of our team. And next slide. So this is our mission, and also happy to say that our summers program is launched again, and we are open to external members again this year. So if you have any graduate or any trainees or undergrads or graduates that are interested in learning a bit more and connecting with a community of trainees, I'll put the link in the chat, but that opportunity is open again. So I will stop there, but happy to answer. And I'm back again in a moment, so I will reintroduce myself then.
Thanks, Corey and Celia. All right, just very quickly, during the webinar, if you would like to come off mute, you should have the ability to raise your hand, and then I can unmute you during our question and answer period. Feel free to also write questions, reflections, thoughts in the chat. There is also a Q&A function in Zoom. So prior to getting started, inclusivity is one of the core values of KBHN and Child Rights. So we humbly acknowledge that we are on a journey to learn and do better and reflect on how to embody inclusivity in our activities. So to understand a little bit more about how we can be better at equitably engaging members and understanding who is in the room today, I'm going to quickly launch 2 quick poll questions. One is asking a little bit about some identity-based data to whichever your level you're comfortable with sharing. And then the second question is asking a little bit more about your knowledge on the topic today, which is all about sustainability. So give everyone a moment to do this. And I won't share the results just because of people sharing some identity-based information. It is all anonymous, just an FYI. But I will read for our presenters. In terms of the knowledge level, we have 1 person who's indicated they're not at all knowledgeable. We have 8 somewhat knowledgeable, 4 neutral, and 2 who've identified being knowledgeable about the topic. So far, no one extremely knowledgeable. All right.
I was going to identify myself as knowledgeable and not extremely knowledgeable. So it's great that we're all still learning and on this pathway to understanding what these terms all mean.
Exactly. All right. I will end the poll there. And then I will pass it back to you, Celia.
So thanks everyone for joining today. So as Vanessa said, we're talking about sustainability today. So I'm going to present a bit more about what we mean. So what the definition is, how do we talk about what is actually sustainability and the different aspects of it. Share a couple of tools that I've found really helpful to get into the details a little bit more. And then I've got one quick example about one of the tools used in action as part of the Child Bright work. And then passing over to our great team that's going to talk about a real example of how this is really happening in a program that I think many of you are already probably familiar with, but really excited for that part. So in terms of myself, I come to Child Bright as the co-lead for the training and capacity building group. And I got brought onto this group because they wanted to increase their awareness and knowledge and skills around implementation science. And that's my jam. That's where I'm interested. How do we think about the how question? And what I am really interested in is how do we keep it going? So there's lots of research that's coming out more around those initial pilots and how do we start something. But I got really interested in how do we stick it, how do we keep it going, and how do we bring it to new places. So I'm currently based at Women's College Hospital in the Office of Spread and Scale. And at this office, my team and I try and look at these questions. So we work on the real practical sides of things, working with teams that are sustaining, that are spreading and scaling, and trying to think about what would make that a little bit easier. What are some of the questions that we don't know about that yet? And try and build up some of the science that we can then use to be able to support the teams. So what I'm trying to do in some of these presentations is to provide a little bit of that basis so you can take a look at everything else that we know, what has been learned about these areas, and see how that applies to some of your work. So what do we actually mean by sustainability? And there are several definitions out there. There's the Moore and Al one, which goes through several different components if you've looked into any of this. But really, it's about that the program that you're working with or the tool continues to be used and it's continued to have the same goals and the same impact that you want it to have and the reason that it was there in the first place. So you can break that into a few different areas, but it's really about keeping that impact and keeping these pieces going. Because if you set something up, that's what we all want. We want to be able to have that longer term impact. We want to be able to find something that works and can continue to work. And so there's some strategies that we can be thinking about for how do we make that happen. So next slide. So getting into a little bit more detail about what do we actually mean by sustainability, because there's a few different components here. And I like this slide from the Center for Implementation because it breaks it down into the areas of what do we need to think about. So one component is what are you actually sustaining? What is the program? So you can think about this in terms of the 7 Ps, which I won't get into, but like is it a practice? Is it a policy? Is it a program? What are you actually sustaining? What are those key elements of a program that you want to be able to continue? Knowing as well that that's going to have to adapt. It's going to have to change. The population changes, the staffing changes. How does that continue to evolve? But how you actually deliver that, is really important as well and will also change over time. So you might have some initial strategies that really get into the initial implementation, but you still need some later on to be able to keep that going because things don't necessarily just keep running magically on their own. They still need some, when new staff come on board, you need the training, you need some of those strategies that help it keep going. And you also need to know, are you still having that impact that you want to have? So that comes to the outcomes and the measurement that's there, because if you're not measuring, you don't know if it's working. So really tying those pieces together, and we can think about that measurement component all the way through. You don't necessarily need to have the same level of rigorous detail that you're collecting in that initial phase to really find out if it's working, but you still want to be able to know, should this keep going? What's the impact that you're having? But fully recognizing so many things change, so many different factors, you need to be able to adapt to the different populations. So the adaptations is a really big part of sustainability while still trying to stay core to making sure that you are having the outcomes that you want to have. And I'll touch a little bit more around that adaptation fidelity dilemma. And as you can probably tell, it's a dynamic process. It's not the end. You always see it, like everybody always ends with sustainability, but it's actually something that you can be thinking about early and should be an evolving process. So it may not have the same priority, it may not be seen as that new thing, but still needs some of that effort to be able to keep it going. And that continual monitoring, the continual adaptations that are there. And part of why you want to be thinking about that is some of the concerns or the impact and the concerns around the long-term aspects of this. And knowing if something isn't continuing or isn't being as effective, is less effective, or is being inequitable, you might have to have that conversation sometimes that something should not be continued. And that allows the space to get the next one that can actually support it to the space to be able to grow. So working in this area, I think that is one of the questions that needs to be asked a bit more. And sometimes it's changes and improvements and more focus that can keep it going. And sometimes it's thinking about how do you take it back because it's not meeting the needs that you were supposed to be meeting. And when we think about the amount of work and effort and that continual focus that you want to have on these implementations as well, you don't want that to be lost. You don't want those to be lost along the way. You want to be able to continue and to have that emphasis. And that brings us back to trying to think about some of these things right away, like right early on, as part of your initial design, all the way through. You see a lot of teams like, yeah, we want to be sustainable, but we're also building this huge program that has 25 different components. And how do we think about what's there? And maybe the 25 components are needed, but looking at what some of those individual elements are that might be able to continue, and looking at that a little bit deeper so that you can be planning for what can be sustained at different funding levels, et cetera. And so a lot of this, like from my having my researcher hat on, you think, oh, this is the program, this is the, you need to stay true to what the randomized control trial said, this is what you need to do. But that's not always how things work in the real world. There are different contexts, there's different people, and you want to find that balance to be able to make sure that you are continuing with that focus on what those core pieces are, so that you are building on that research. But what are some of the ways that you can change to be able to improve it? So I like my Oreo example, except it starts to make me hungry because it's lunchtime. So you've got the original, and it's great, and it's working, and it's there. But in some cases, it might be that you brought it to a new group to be able to increase awareness or funding or there. So you've got your pumpkin spice version, which I've never tried before, but I saw that it existed and was kind of intrigued. But more of the added value that can bring, or the gluten-free version where it makes sure that this is now something that is more available to people that couldn't have that before. So how do you think about those different adaptations that are needed as part of this process while you're still not getting too far away from what you were originally meant to do? Which brings me back to that original point around the monitoring, that you still know if this program is still continuing to have that same impact that you wanted to have in the first place. And so when we're thinking about those planning for sustainability, there's lots of different elements that come from this around the different benefits that you want to have, the partnerships that are there that really bring this all together. What are those different practices, the procedures, the individual and organizational and the policy pieces? And how can you be planning for some of the spread and scale of this or the unintended consequences? And these are all reasons that you need to be thinking about some of these pieces quite carefully over time, and that needing to plan for these different scenarios of different levels of funding, different staffing, those kinds of things to make sure that something can keep going to be able to continue that impact. Next slide. So to help us keep track of all of those things, because that previous slide, there's a lot going on there. A lot of the different things to think about. So there are several frameworks and tools that are designed to help you think these things through. So each one has different benefits. If you think about the dynamic sustainability framework, it really helps you think these different tools and recognizing that things change over time. There's that dynamic element to it, but also that there might be a bit of a drop off in many cases, sort of a voltage drop that comes with some of the sustainability, and how do we kind of account for some of that. And I believe there's some tools that are being used in the case example that we'll talk about in a moment, but I'm going to focus on one that I resonate the most because it's one that just clicks with me. Like I can understand them, I can see how that works, and that's the program sustainability assessment tool. So it can be used in a few different ways, but it really focuses on what are the elements that you need to think about to keep something going. So you need to think about the funding, who are the actual partners, who's involved, who is aware, so the communication aspects. How do you bring that adaptation, the monitoring that comes with that? And I think the organizational capacity is one of those huge ones, because you can have all of these big aspirations for sustaining, but the next big thing comes along that takes all of your staff away. How do you think about your capacity to be able to keep that going? And then all of that comes together within some of the strategic planning, recognizing that sometimes as much as you want to be able to control, there might be things that are outside of your control, and that environmental support that comes with it. So this tool can be used in a couple different ways. So typically I end up using it for these ideas in a way to be able to group these domains, but it's actually a tool in itself. It's its own survey. So the next slide gives an example of oh yeah, thanks for adding it in the chat. So you can go through the descriptions of each one, or you can also go through the actual tool. And this can be helpful if you're working with a team and like you're starting at the beginning and you want to see where your progress is, and it maps it out nicely. So I'm not always a fan of scoring these kinds of things because it's really, really hard to put a number on some of these. But especially if you're using it over time, you could see where you're making progress or where you're not, and really just as a discussion point to be able to do with your team to see where your next steps might be. So where we have used PSAT quite recently, and if you've seen any of the other ChildBright, we've presented on this a couple of times. So it's a postdoc of mine that has been working on this project because ChildBright has been thinking about our future and the sustainability plans. So to be able to, part of that process was also understanding what did our members want to sustain? What did we think was working well? What did we want to see for the future? So ZNAT interviewed and held focus groups with members from across all of the network. We had 41% that were people with lived experience from across the network to hear what they were thinking. And we are grouping it into these areas. I'm not going to go through the results today, but there is some other presentations I can share if you're interested, and the paper is hopefully submitted soon. But we really focused on the organizational capacity side of things and some of that partnerships, because those really came out as quite strong here. And thinking about this from a training perspective as well. So how do we support the trainees, the postdocs, to be part of this network and continue on with that future and the support and the organization that comes with that to really push us forward. And what does that leadership look like? And there was a lot of discussion around having partners in leadership roles and how do we make sure that can continue. So one of the pieces that we didn't find that came out of this was actually the network component. So on I believe it's my last slide, was just, we couldn't figure out where, like ChildBright is a national network. There's so many different components. We have internal, we have external partnerships, but the network piece of all of this didn't quite come out when we were using this tool. So what were those added values of being part of this community, this connection, all of these different elements that were coming through, and how does that support individuals? So this was our experience with using the program sustainability assessment tool. I found it one that really helps me to think about a little bit more deeply about all of these things that you need to think about, because for me, if I don't use some of these frameworks, it just seems really overwhelming for all of these different pieces. So it helps to break down what are those places, what's your next step, how do you build this into the work that you're doing. So I believe that's it for me, and we'll pass over to the rest of the team.
Thank you so much, Celia. That was excellent. Lots of really helpful, practical, foundational information. And I definitely have some questions for you, but I will pass it to Rachel and Lynda, who are going to share an example about the F words.
Thank you so much. And thank you, Celia, for setting the groundwork for us. And it's really nice to be able to tie our practical examples to the conceptual ideas and definitions and the knowledge base that we have around sustainability in the field. My name's Rachel Teplicky. I am an occupational therapist and the Business and Engagement Officer at CanChild, which is a Center for Childhood Disability Research at McMaster University. And out of CanChild, we are running a KBHN-funded study looking at implementing the F words for child development in organizations across Canada. So our program that we have called it the Can Implement F Words program, and Lynda and I will be sharing information from this program with you today. So we'll be looking at sharing some of our sustainability examples, both from the study that we're running right now, and also from work that we've done with organizations over longer periods of time. And then we want to leave time for all of us to reflect on sustainability learnings and questions, because you'll hear some very successful examples from us, but we know that that's not always the case, that success happens, but there are also challenges and stumbling blocks along the way. So we want to bring some reality to that as well, and have some discussion and hear from you on how you have been working around bringing sustainability to your work too. For those who haven't heard about the F words, this is the F words framework. It's a set of 6 words: family, fun, friends, functioning, fitness, and future. And these words were used to really bring to life the World Health Organization's framework for health, the ICF framework. And you see in this poster here that's available on the CanChild website and the F Words Knowledge Hub, how the ideas from the ICF are directly linked to the F words themselves. And what we have found from the F words is that they present a set of ideas that are very strengths-based. They allow conversations with children, families, youth around things that are very relevant within their lives, and really helps to focus the work that is done within children's services on the things that people want to be able to do, and helping to move away from the idea of needing to fix the person and really thinking more broadly about what we can do within the environments, within really just looking at everything that's happening within their lives. This is a QR code to the F Words Knowledge Hub if you do want to learn more about that work. In the Can Implement F Words project, the process model that we're using is the knowledge to action cycle. And one of the things that we acknowledge from this cycle is that sustained knowledge use comes near the end of the cycle. And as Celia said, we really want to make sure that sustaining knowledge use is thought about as we go throughout the entire process. So certainly thinking about this at the beginning of the cycle. And as we're going through and selecting, identifying barriers and facilitators, selecting strategies for implementation, bringing forward ideas of sustaining the knowledge over time is part of what our implementation team does with the centers that we're working with. And when we're thinking about those implementation components or sustainability components that Celia presented, we're thinking about the thing. What is it that we're really wanting to see sustained? And with the F words, this is really a conceptual set of ideas. It's not a new assessment tool or a new program or a new therapy intervention. It's a really overall way of thinking that we bring to the work that is being done with children and families. And so when we think about that, the F words actually provide a lot of opportunity for adaptability. And I think that's one of the things that has really helped this to be a body of work that can be implemented and sustained. We're thinking about the hows, and we're thinking about how these adopt over time. So we're thinking about the strategies that organizations are using. And for example, we can think of an easy one, thinking about knowledge and awareness. At the beginning, knowledge and awareness campaigns might need to be very robust and bringing in all of their staff, presenting ideas to families, thinking about how these new ideas are coming forward to the organization. But it's equally important to think about over time, how do you continue to have education opportunities for people who are new to the center, for new families, new providers, and being able to make sure that knowledge and awareness training is still available for those individuals. We think about the who as part of the implementation, and knowing that this also will change and evolve over time. You'll have your implementation teams who might start off and be, very well-rounded with people from many different parts of the organization. That will change as you're going through and moving toward a sustainable plan. And then outcomes and impacts, and always making sure that you're showing that what you're doing is making that difference. I also really like the PSAT tool that Celia presented, but one that we have been using in this Can Implement program is the long-term success tool. So another type of tool that enables you to look at different components that help to support sustainability. And we've been finding it to be really useful to help teams in their planning process. They're developing their implementation plans, as they're doing that work and developing strategies, to also look at this tool and think about what things might be missing. So right now they might be putting together some strategies that look a certain way for their initial implementation, but then as they move forward, they might want to be shifting and evolving those that will help to support their sustainability. Then strategies that have been found to support F-word sustainability. So this comes and won't be a surprise to probably many of you on this call to see some of these things reflected here. Thinking about what's happening in records and forms and documents, having ongoing leadership support, involving multidisciplinary teams and champions from many different areas, having monitoring systems, relationships and engagement, and so on with the other categories. And I think these are all really very important. And I'm going to share some practical examples from one of our organizations that is many years into their F-words implementation and have really seen a successful ability to sustain these ideas across their organizations. And you will see how all of these different strategies have been brought in. But one thing that I think really was a aha light bulb moment for me as I was planning for this presentation was thinking about what we do as an implementation team at CanChild in supporting the knowledge about implementation science and practice with the people that we're working with. I think that one thing we don't often talk about is the amount of training that we provide to the organizations that we're working with, to the local implementation teams, and then also making sure that our partners at the clinical level, at the clinician and management level, at our family partner and people with lived experience level, that we're bringing partners along on the journey of becoming implementation support specialists. And I think this level of training and knowledge development that happens not only around the ideas of the F words, but even more importantly around implementation science is something that has been a very, very important key factor in making sure the ideas are sustained, because the people who are doing the work really understand the importance of that entire implementation science process. So I'm going to share a few ideas from you from our partner, the Children's Treatment Network. And this is an organization that provides developmental and rehab services for children kind of in the central area of Southern Ontario, so kind of ranging from Toronto up through to Cottage Country. Many of you will know Kim Hesketh, who has led their F-words implementation over many years. She's not with Children's Treatment Network now, but this work really that I'll be presenting really represents the efforts that she and her team brought to life. And this implementation at CTN took a number of years. They had a 3-year implementation plan that they developed and then have continued that implementation as part of our KBHN funded work on F-words implementation. So sustainability at CTN has been visualized in this tree diagram. And Kim added on the different leaves things that really were important and it focuses for their organization. So you can see building the F words into their organization quality plan, having partner and parent engagement, building it into the official pillars of their organization, their policies, procedures, and making it as required knowledge about the F words as required onboarding practices within their organization. So I'll show a bit more detail here. Kim also identified factors of their success for F-words implementation in these different categories. And what I really liked from this outlay that she put here, not only are the different categories reflected in those areas that we know are important for sustainability, but that they identified that they started planning for sustainability from the very start. They knew that they didn't want this to be a fad. They didn't want it to be something that they put a lot of effort in and then, faded out over the next year. So thinking about how they were able to make that happen from the beginning. And one of the things that they did then to do this was to bring changes at all these different levels of the organization. So it wasn't just happening in their programs and services. And that's a very typical place when we're bringing change at a, conceptual kind of therapy type practice level. But they worked at all these different levels, thinking about how they engaged with their leadership, making changes in their health record system, not only in their documentation, but actually in the structure of the system as well. And she tells a story about their IT person who attended their F Words training session and the next day ran up to her and said, Kim, guess what? I have this great idea. You know how we have the S drive for our shared drive? Well, I'm going to change it to the F drive. And he was so excited. And it was just one little simple change, but it showed that commitment at all these different levels. Within their policies and procedures, then they had documents that talked about how they would brand different communication tools and different documents that would use a style guide, bringing in the F words and the F words logo along with the different colors of CTN. So they put not only in thinking about what they did at a process from a service delivery intervention, but thinking about what happened in their communications, what happened in sharing information more broadly with others. Forms and reports, and this is a very common place where organizations start when thinking about making changes, and it's very supportive over the long term. If you're going to be able to build these ideas into the reports and the documentation that people are expected to complete, it reminds them to use these ideas when they're doing their practice. Thinking about community and family engagement and using ways within their communications that were already existing, and then building it out, not just as for example, in their community corner, what they used the document that's used to communicate with families, instead of having the F words just the focus of one newsletter. They built the focus of the F words into all of their newsletters. And then they would take 1 month would be a focus on fun, another month might be a focus on future, but it continued to present these ideas and put them in people's vision. So it just became an expected part of what people were doing. And then they did a lot of fun things too to engage their employees. I heard from someone the other day about how the F words are actually a really cool tool for those icebreakers at the beginning of meetings. And many people kind of, you know, really don't want to take part in the icebreakers, but when you put them around these ideas, for some reason, it lightens the mood and it really helps to bring forward that connection to who they are as people. The F Words Bingo was an idea that CTN put together during COVID, actually, and engaged their employees over during the COVID time while they were at home. So they've brought it into all of these different components of their organization, orientation training, introduction of new staff. Vanessa had to do an F words collage when she started working with CTN. So it goes to everybody. And then you can see just how it can be integrated into all different activities that they do with kids and families. And this was an activity out at the park, 6 different pedals on the windmill, the different stickers of the F words around the edges. It doesn't have to be anything serious and, formal. It can be these fun, engaging things and just bringing the ideas forward. And these are ways that have really helped to sustain and engage people over time. I'm going to pass over to Lynda, and who will share her experiences as a parent partner and knowledge broker, and I'll let her introduce herself.
Thank you, Rachel. I just love the examples from CTN and how they really encompass everyone. Just laughing the whole time you share them and getting more ideas. So I'm here as a person with lived experience. My name's Lynda Moore, and as Rachel said, I'm a F-Words family knowledge broker. And I'm a parent with a child who receives services, learns, and plays in BC. So I'm sharing some images of friends as a reminder that families can be strong champions. You can work with families to discover how this change impacts them and what they can offer to your implementation plan. They may identify different facilitators or barriers or have considerations that are unique from their perspective. An example is when a parent panel was brought in to edit and comment on changes to reports in a health center. The staff implementation team found a section to be redundant for their purposes and removed it. But from the family's perspective, that section was vital information that they needed when in appointments outside of the center. So for reasons of transition to partner services, the family panel asked for the section to be added where family could include assessments, tests, or other information that's listed as important to them. So from the family lens, I think about sustainability with the idea of stability. And where might a family feel instability when there is a change initiative or before? And addressing these areas, such as transitions, can set up the possibility for success. Next slide, please. So looking at transitions as areas to address sustainability, think about the implementation plan and how it moves through your space. Where you start, when you build out. Think about the sustainability of the thing you are implementing may help you find avenues of transitions to consider and when. There's sometimes a champion or a passionate individual or a group really leading the change. And how does the project continue if they leave that position? What about new staff or temporary staff, new families coming in during your implementation or after, as opposed to the ones who are experiencing the change while it happens? Often we hear about transitioning in and out of services as an area to highlight to start with the F-Words implementation. What about between services within or to partnering organizations such as school-age therapy, working in school systems? And when you think about schools, there's examples on the CanChild website, the F-Words Knowledge Hub, for communicating what the F-Words are. There's examples from some of our organizations, like the ones you see here from Queen Alexander, in our F-Words Community of Practice on school transition forms. And on the right, you can see an early adaptation from a local school inclusion specialist so that the children with designations are not only using the F-Words when accessing school-age therapy, but the school staff are using them to learn from families and youth how the IEP and EAs can work to support them under the F-Words concept and language. When the school originally added the F-Words documents as extra forms, they did not see success and sustainability. It was not embedded and therefore could be forgotten or even rephrased to lack the impact. So to solve this, the inclusion teacher at one school combined forms using About Me, F-Words, and in updated versions, their own specific questions for elopement, food safety, allergies, and sleep habits that they needed to know at the school. Now as one document embedded, they're working towards a sustainable implementation. Like the parent panel I discussed earlier, the school included caregivers and youth while adapting the document so they could best support information that the families wanted or did not want shared as part of the IEPs. And this is something that I really enjoy about the F-Words in general, is that it's more than collecting information, it's about having conversations. So you can also open your conversations when you're looking at your implementation. Next slide, please. So families can be strong local champions and lead spread and scale efforts by their connection to other associations and community programs. And this is happening all over. The Community Pillars Project of BC is built on the idea that families move through spaces that often feel like silos of care, where they're carrying the information and they're adapting to meet differing conversations. And we would like to change that weight and are implementing the F-Words to create common language and understanding so that these spaces feel more like pillars of community support. Similar to how the school representative needed to consider how they would specifically implement the F-Words to build sustainability within their use, the community pillars, which also includes teams in advocacy and adaptive sport and recreation, are working to learn the F-Words foundation and implement with the Can Implement project how they can use this approach. Why is it beneficial to them in the work that they do, and how to create a sustainable change pathway for them that can work independently, but also with a larger goal of connecting the community of a child using common language and AFWORDS guided goals. This graphic demonstrates the Community Pillars Project goal to support an individual shown here in the South Island. With the goal of creating stability by acknowledging, assessing, and building sustainability, we're moving towards concepts of successful and meaningful implementation, and then possible spread and scale. Thank you.
Lynda, I love how that I haven't seen the arrows come together like that with how it builds a star in the middle. And you had some beautiful, I'm glad it's recorded. She had some really nice quotes there too. And thinking about, I love the idea of thinking about the stability around sustainability and how that's perceived from the people who are receiving the services. I don't know that that's always taken into account really well.
Well, when I was brought in to work as a family partner, I didn't have any training. I just had my lived experience. So my coming from that lens and always trying to remember that that's where I came from. How did it feel to be part of these services, and what is the relationship that you have with the people that you're seeking these services from? So that was the word that I remember before I learned the language that we use on a more strategic level.
Thank you. And so that leads us into thinking about our learnings and kind of what we're wondering. And we hope you've heard from this, obviously, the essential importance of family engagement. And I would also say clinician engagement in that as well. We can't implement these things if we don't understand the clinical environments and if we don't understand the family's realities. So bringing those both to the forefront is so important. Thinking about how we balance sustainability planning with team capacity, stages of implementation, our funding and resources, and how we're able to do all of that. And then sustainability planning that happens across multiple points of the process of implementation. For us, thinking about that knowledge to action cycle, but any of the process models we go through, how are we building that in to all the different points? And what we'd love to put out, I think we're always working toward, is thinking about how we are monitoring our sustainability, and would love to hear from others, like what is it that you have done or have thoughts around or questions. And thinking about how you might be navigating sustainability when there's changes within systems. So these are two things we're pondering and really thinking about as we're building out sustainability with the organizations that we're working with. So I'm going to stop sharing here. Oh, I guess I can keep sharing because there's only 5 of us on the screen anyway. I thought we could go and see everybody, but we can't.
It's totally up to you, Rachel. You can stop sharing it if you
Yes,
want.
and I can see the chat easier.
Yeah, there you go. Well, thank you so much, Rachel and Lynda. That was beautiful, as always. Always learning so much from both of you. And similarly, Rachel, I wrote down that quote you said, Lynda, around the stability piece. You speaking also made me think about you focus always so much on the collaboration and connection that F words lends to, and how that also supports sustainability by having that multidisciplinary, families, kids, like something that everyone can understand. And I think that is something that also helps to support the sustainability of the initiative. All right. Amazing. So I have some questions, but I will see if there's any in the chat. Lots of thank yous, lots of reactions as you were presenting. Um, Maybe I can kick off by asking. So, Rachel, I loved your like little aha moment in the presentation thinking about sustainability. And so I kind of wanted to pose that to both you, Lynda, and you, Celia. What has been a aha moment or learning for you as you're working through implementation and thinking about sustainability? Maybe something you didn't think about previously, or something that you now have identified as really important. Not to put you on the spot.
I got super lucky. I put it in my slides.
I think for me, it's not like a aha moment, but something that's an ongoing part of thinking about sustainability is that balance of not quite like the being optimistic, like you want these things to work and really being able to drive that and the importance of that because you need that to be able to keep thinking about the positive impact that can be having and how you continue to make that, but still needing sometimes that reality check every once in a while of, is this something that's still working? Should I continue to be advocating for it? And finding that increasingly challenging, and keeping some of that optimism and keeping that effort, especially when there's so many things and so many amazing programs you really, really, really want to keep going. How do you continue that, and how do you kind of think about that within the context that we're in, and the different factors that are always competing? It can be easy to get discouraged by some of this topic, or focusing on this. So how do we maintain that optimism, but optimism when it's needed or deserved, or whatever word you want to put in there. But that's kind of one of the ongoing, it's not really an aha moment, but one of the ongoing things that I always think about with sustainability.
Well, mine sort of bounces off of that. I always enjoy acknowledging those who were not as thrilled. So I know we talk a lot about having champions, and I remember watching Kim present about, looking at your facilitators and barriers when I was first getting to know about this process, and realizing that when you have just champions and people who believe in it, you're missing voices, you're missing perspectives that you need to address. And you may see something that was done in one area, think it's great for yours, and you could be missing the mark. So when you look at those barriers, or you listen to the people who are more unsure, or who have something that you might just think like that's negative, that's actually an opportunity for learning. That's something where you might learn this is something to pivot around, or this is something to work through together. So building off that optimism, thinking about champions, I really enjoy hearing from the people who are not as excited, learning why, and then seeing what we can do together with them.
Lynda, can
Just
I
wanted
keep
to add,
up with that? Oh, sorry, Celia. I just love that so much because I was gonna say something similar, but I think really complementary to that, which is to really, really be successful in long-term sustainability, I think you need to be constantly adapting, and especially with that kind of family, persons with lived experience focus, with all adaptations, because ultimately, and rightfully so, we're moving away from language like change management, but implementation, we're bringing something new, and that has lots of emotions that's tied with that. And so the greatest champion you'll ever have are the family members. And if they are buying in and are excited about this new thing, this new what, the folks delivering that intervention will also get excited, because that's why people get into this field. They want to do better for families. And so I think one of the key ways to make sure that we're constantly kind of following that North Star is making sure that families are constantly providing that iterative feedback so that we can adapt in a way that serves them, because then they become the great champions that will make all of our other teams kind of optimistic about delivering this new thing, this new change and workflow and service delivery, whatever. So I think that constant adaptation, but really, again, the critical piece of keeping lived experience at the center of kind of design thinking, because that brings along everybody and keeps our programs working really, really well. And that partnership between clinicians, whoever else is delivering that service piece, and families. And so, yeah, really appreciated that reflection, Lynda.
Amazing. Thank you. And I see similar sentiments in the chat. And I see Kimberly had a question, which Rachel, I think you answered there, but if you wanted to elaborate. So Kimberly was asking, wondering how the F Word supports the adoption and implementation of other programs and interventions within the organizations implementing them.
Yeah, and then she also added, like, thinking about how the F words represent that foundation of service delivery, and I think that's so essential in thinking about how you're bringing when you're, and I think it ties in, Celia, to what you're saying too, like kind of that knowing when to say when, like if something's not working, like we develop ideas and things in research and we get so attached to them like they're our babies. Like, how do you say it's maybe we need to do something else? But what I do love about the F words is that it does tie to being family centered. It ties to these ideas of thinking about what people can do, moving away from fixing. So I think it's the F words where they're finding a great home in organizations is that they're helping to promote those changes in service models that align with the ways that people are thinking, that families are looking for this type of support. And so I do suspect there are those changes, especially because we do that implementation training to help support learning in other change areas too. So, but I'm not sure we've asked that question. Vanessa, I think we need to add that to our evaluation. What else have they implemented using these ideas?
Agreed.
Great question.
We have a few minutes left. I do have another question, but I can pause. Corey, I don't know if you had a question or if there's anybody else in the chat.
I have a question actually,
Yeah,
if that's
of
all
course.
right, because it kind of builds off what we were just talking about, and some of the, like, curious on your monitoring piece. Like, it's a concept that used in so many different ways. So how are you thinking about your like category? My research hat on here, but like the monitoring and the evaluation and some of those pieces to really capture what you're learning.
Celia, that was the exact question I was going to ask you.
I was going to put it back to Vanessa. So, see, I think one of the things that we're working with organizations on right now at the very beginning is some of the tracking and thinking about what they're actually doing within their implementation. And really trying to be thoughtful around that because it's so easy to get a year down the road and think that you'll remember each of these things that happen, but trying to find a good way for them to track their strategies and their meetings and their decisions and discussions that they have so that we can see, what has happened and what might make a difference. And then thinking, then the other side of the monitoring is how is this having an impact on families? So it's one thing to collect all those strategies and this is, I think, where we always have such a challenge in our children's services sector is especially around ideas that are more conceptual. Like it's not like we ran the program 5 times and had 40 people attend. It's more thinking about how are people thinking about children, their development, their futures, young adults as they're moving out of the programs. Those are some pieces I think that we still need to figure out. We will be using some tools like the measure of processes of care to look at family-centered service delivery from parent aspects and things like that. But
Yeah, thanks for that. And that the tracking piece comes up a lot in my work. So if you can share how that goes and how you use it, because people are really interested in keeping those details, but then how do you translate that into stuff that you can use? And you end up with so much information. So the process of actually tracking some of these things, I think, is a really interesting area. And there is some tools to help, but I think we need more examples of how that works and how we can support others to learn from that tracking and remembering these details, because it's some of those details that really, really, really drive so many other things.
And we did learn some of that from our pilot implementation project that we did with 5 organizations and had some very detailed things that we were asking them. And that was the feedback is like,
No.
too much.
Yeah, there's a balance in there. Like,
yeah.
you can't keep too much, but you also want to keep the details. And like, how do you track
Exactly.
it? What physically are you doing to be able to track some of these things? I get a lot of those questions lately.
Exactly.
Yeah.
We should bring some tools. Maybe we can do that to like one of our drop-in sessions.
Exactly. I know we're at time. I just wanted to add one final thing. I feel like because I asked teams this when we were starting to think about, how are we monitoring this? And while they have like maybe some of those tracking sheets or forms that we've developed for them, they've often said they found the most helpful is just having it as a standing like agenda item. And that's where they'll check in their meetings. How are people, using the F words? Any success stories to share? Any challenges? And that's often then how we identify some of the needed adaptations to some of the strategies. So we found that to be really useful, but we're not really collecting that kind of data. So it's interesting. Thank you so much. I know we are at time, everyone. I think we could go on forever. Maybe this should be a session at the KBH Plus conference. We could chat more about that.
Well, abstracts are due, right?
But very much appreciate our presenters being here today. Thank you, Corey, also for always being here for support. Thank you to everyone who attended and sharing your reflections and questions in the chat. We really, really appreciate it. I put a feedback survey in the chat if you have time. It will also be sent in a follow-up email. But thank you, everyone, and we hope to see you at our next webinar next month. Have a good rest of your day.
Thank you.